And I think we're live. Let me quickly verify that. Yes, that's right. Okay. Hello, everybody. I hope you're well. Thank you for joining me today. I will spend the next hour here with you, um, welcoming you, hearing your stories, and if you want to share anything with us, with other men watching the stream just like you, please do so. I'd appreciate it if you said your name, where you're from, a little bit about yourself, and ask any questions you have or just say hi. If you have any questions, I will be happy to answer them. And I think also other men watching this should also give in their opinion about the question or just about the story if they want to. Ideally, I'd like to actually create an online group. I don't want to say certainly support group. There's definitely going to be support, but I just want to have an online group for men who face the diagnosis of prostate cancer. Either they currently have high PSA and they're trying to basically treat the prostate cancer, or they used to have prostate cancer after successfully treating it. Because this experience just changes someone, and they have a lot of ideas, perspectives to share, and I think men getting together, especially in today's world, is becoming more and more rare. That's why I would like, hopefully in the next month, to create an online support group that meets every week, and people can catch up, share their stories from the comfort of their couch, wherever they are in the world, no matter how remote, either in geographical location or just in life, let's say. I hope that idea catches up, and I hope it helps people. So I'd like to get it going soon. Any opinions, any ideas around that, please let me know. And I would also like to share a Facebook group that we're gonna talk anything about lifestyle for prostate cancer, and it's not just the physical when it comes to what to eat, what to do, take this or take that, what should I do. I would also like to, for men who just got diagnosed, to get a little bit of info around the therapies, because many times the people who are there to treat you don't have the time to sit down and explain things, whereas after a diagnosis everyone starts researching and they're becoming an expert. So just sharing a little bit about the treatments available, but also in that Facebook group share just emotional support and anything that comes up. So I will post the Facebook group in the chat, so you can basically, I've just posted it and I'm gonna pin it as well at the top, so please join the Facebook group. In this Facebook group I will actually post a link once a month for the live stream. We're gonna have a live support group or catch-up group or men's group Okay? So definitely join that group. Okay, hello Philip. How are you? Long time no speak. I hope you're well. With Philip, I actually met in London last July, a year ago, and we had a beautiful um, meal together in a very fancy restaurant. Philip, I really loved that, and I hope I can visit you again sometime. I'm keen to hear about your news, so please drop me an email. It's always a pleasure hearing from you. But you definitely added to my experience when I came to London. So thank you for, I reached out. I said, hey, I'm gonna be in London. You said, let's meet. So we did that. So nice to see you. Anyone else wants to say hi? Please tell us where you're from. I also would like to hear your questions because I'm planning to. I haven't been. There's been a lot of life transitions lately, so I have kind of fallen off making content. I want to start making more content, and as well, lately I have been getting some more um, clients. So I'm basically working one-to-one with men with prostate cancer. We're catching up every week, 1 hour calls. We're working through an app where, apart from managing the side effects and helping them improve the success of any treatments they're undergoing, we are basically improving anything health-wise, fitness-wise, and life-wise. And we also do a lot of work when it comes to the emotions, the psychology, all that stuff, because unfortunately prostate cancer is a very lonely journey. And I'll say that again, that when women get diagnosed with especially like a breast cancer, they tend to reach out, whereas when men get diagnosed with cancer, and especially a prostate cancer that tends to hit your masculinity, men tend to check out. So it's very important during my coaching to touch base with them, listen to them, be there for them, because it's a huge component of the journey to better health. And health is comprehensive. When I say health, I mean physical, cognitive health, mental health, emotional health, and social health. All that stuff can be worked. So I have been doing a lot of deep work with the men that I work with. That's why time went, I didn't have time to make videos, but I would love to hear your questions, and I want to start making more casual videos, because my past videos have been they're very academic, I feel so, and I feel like overanalyze and use a lot of scientific jargon, even though I try to disseminate. I feel it's a little bit too heavy of a analysis. So I want to create more casual, shorter and simpler videos. That's why if you share your questions with me, will be very, very helpful for me, and I hope I can also help you and answer your questions. Thank you, Philip, for your kind words. Keen to hear your news, Philip. How is that going? Olufemi, hello. Lagos, wow, Nigeria. Thank you for joining us. Maybe we have the same time because Greece is on the same time zone, I think, as Nigeria. Maybe, I'm not sure. But thank you for joining us from so far away. Well, you know, I haven't. It's a little bit interesting now. Olufemi, if you can, I would love to hear your story if you're willing to share it with us. And just tell us a little bit about if you have a diagnosis, how did that happen? I'm very interested to hear, and I think other men from Nigeria or surrounding countries might be interested to hear how has been your experience with any prostate issues, or if you have prostate cancer, or maybe you have high PSA. How has been your experience through the medical system or any support groups that you have there in Nigeria? What has been recommended to you? Have you had sufficient guidance? So please do share that with us. Now, you will know that in black men in the United States have much higher risk of getting a diagnosis of prostate cancer, and unfortunately much higher risk of receiving a diagnosis of more aggressive cancer. It's very unfortunate, but it is multifactorial every time. It's partly genetic, it's partly also their lifestyle and the environment. So it's very interesting, and I want to study that. I actually, in the future, I'm dreaming of creating a travel show where I will go to different countries and explore their practices, how they used to live, the culture, the diets, the social interactions. And in Africa, do you know how they say lately that sugar causes cancer, or glucose causes cancer? So what you should do is go very low carb or keto. It's very popular lately. Something I do not recommend, by the way, definitely for prostate cancer. Keto is basically the worst diet for prostate cancer. Why? Because prostate cancer is a hormonal cancer. So if you feed it high fat, you're fueling it. Okay? So it bugs me to hear people talk about it like cancer. What cancer? It's vastly different. Like astrocytoma is vastly different to prostate cancer. Some neurological cancers might benefit from a low carbohydrate environment. Some therapies, like certain chemotherapies, might increase their effectiveness in a low carbohydrate environment. But when I hear people say that sugar feeds cancer, it immediately shows to me that they don't know what they're speaking about when they use the word cancer. It's like telling me that a certain vitamin helps viruses, or is good against viruses, or this person got a virus. What kind of virus? Did he get the common flu? Did he get COVID? Did he get HIV? Different cancers are completely different diseases, okay? So just telling people that sugar feeds cancer and getting them to go to a high-fat diet is really really bad. And yeah, especially for hormonal cancers like endometrial, breast, prostate cancers, horrible advice, unfortunately. Yeah. So, for example, there is certain tribes in the Africa that most of their diet is carbohydrate. Okay, they're eating a lot of cassava, a lot of plantain, a lot of carbohydrates, and the rates of cancer are extremely low compared to the US. Well, if sugar feeds cancer, why these people eating all this carbohydrate don't have cancer? That's the kind of stuff I want to actually explore. I want to answer first in this channel, but I'm also planning to, in the future, have like a bit of a travel show where I will visit different cultures and countries and explore their culture, as I said, the diet and stuff, and see how differently they lived compared to our Western countries. Maybe I need to find a sponsor for that. So if you're interested in sponsoring that, please send me an email. Philip, thank you for joining us. Thank you for saying hi. Please send me an email. I'd love to catch up with you. Okay, for those watching, please say hi, where you're from, and if you want, just share a little bit with us about you and about anything around a diagnosis or anything around prostate issues, or yeah. Now, a topic that has been a little bit, while I'm waiting for the chat to catch up and maybe some more people to join and say hi, a topic that has been on the news in the past 6 months has been Joe Biden's diagnosis of aggressive prostate cancer. It's interesting how they say that they haven't tested his PSA since 2014. And you might have heard that a lot of men over the age of 70, they are told not to worry about their PSA anymore, which for me is really bad advice. They're saying that because the chance of getting prostate cancer in Western countries over the age of 70 is high. You might have heard the statistics that 1 in 8 men will get prostate cancer. In the United States, 1 in 4 black men, actually. It's really sad. In Australia, the latest statistic from Queensland, that state of Australia, was 1 in 5 men in general, which is crazy to hear that. So because there is some doctors I've met, they say that any man who lives long enough will get prostate cancer. That's the reason why they say don't worry. If you're over 70, don't test your PSA. If you get prostate cancer, well, you might die from something else before that, which for me is not, I don't like that. I don't like that at all. I disagree with that. The reason they say that is because traditionally when someone was diagnosed with high PSA and in the past they got a digital rectal exam, now they're getting a biopsy. The biopsy, if they're over 70, it's basically a surgical procedure that might actually cause something that will cascade in other problems. But then when they if they received a diagnosis and they're 75, they would be asked to have like a surgery. Now they stopped doing surgery in men over 65 because of the It's heavy for the body. They tend to do radiation therapy, whereas they try to avoid radiation therapy um, in men in their 50s, because radiation therapy increases the rate for secondary cancers later on. So, or they would just be put on androgen deprivation therapy, which is their testosterone suppression hormone therapy. So they will be put, they basically they tend to overtreat. When they diagnose prostate cancer so far, they tend to overtreat. It's only been in the last 10 years that urologists and oncologists have become a little bit more cautious, and they, in Gleason's 6 and sometimes Gleason 3+4, they would recommend just watchful waiting, as they call it, just active surveillance. In the past, they used to overtreat. That's why they asked men over 70 not to do a PSA test, because of the overtreatment. But the problem is not there is no overdiagnosis problem, there is overtreatment problem. For me, if I was 75, I would still want to have PSA tests, because I want to know what's happening in my body. And if something is out of balance, or I have something, I would like to know about it first of all. I'd like to have control over my body and see if I can do something, and just weigh the, you know, the benefits and the drawbacks. So I think that's what happened with Joe Biden. It's not that he hadn't had a PSA test since 2014. I think they knew, and he was having prostate cancer, and because he's the president of the United States, like, they probably do a whole cascade of tests to make sure their health is up there, and they prevent stuff. So I'm pretty sure they knew it at least a decade ago, while he was still a president, because prostate cancer is not like a pancreatic cancer where it comes silently, and when you know it, it's already stage 4. They're usually gonna be a lot of symptoms. There's gonna be urinary problems, there's gonna be pain, yeah. So that's why I think, and you would see that the cognition of Joe Biden, even while he was a president, was started to decline a lot. Maybe he was put on ADT and we didn't know about it. But anyhow, that's just my theory. I would like to, yeah, I think it's your right to have a PSA test and to do any blood test or any test you want. I don't think anyone should be a gatekeeper to your health. And I think you should be informed about what's going on in your body and be able to choose what to do with the information you're given. I think that's truth freedom, the ability to choose. All right, please say hi. I'm speaking by myself today. Tell me if you have any opinion on that topic. Tell me what you think about the idea of having an online men's group and having a Facebook group, first of all, which I have pinned in the chat. Please join. I'm gonna be sharing some exclusive content there, and tips and tricks. And you can ask anything, and you can also offer your opinion and your um, just help to other men joining the group, so your perspective is valuable. But I will also be posting a link for a, let's say, more of a private men's group that's gonna be a call. So you'd be able to, just like how there are support groups, I actually used to join support groups for prostate cancer when I was staying in Perth, Australia. It's very important for me to, I was being asked questions, but for me it's more important to hear the perspectives of people going through prostate cancer, just to understand it more. So there's gonna be a support in that group, but it's also gonna be just a group of men. Happy to have any partners as well, because I think partners are it's very useful for partners to be informed, get the perspectives as well. Men are great at hiding how much stressed they are from their partners and their family, how anxious they are, how afraid they are. So, and yeah, it's very important, I think, for partners also to be informed. So I would like to organize that. I'd like to organize a monthly video call with participants. I'll be facilitating it, and people will be able to just have time to say anything, say where they are, how they have been lately, share their experience, ask any questions, and then I will allow just free chat for anyone who wants to offer support or just say anything. But I think simply the fact that you're being heard by others who understand you and have been through the same, let's say, a similar journey like you, is liberating, is relieving. So I'd like to offer that. So let me know what are your thoughts about that in the chat. And if you're interested, please join the Facebook group where all that will be conducted. I've pinned it in the chat. For those joining, some questions for you. So maybe you can share a little bit with other men watching. What would you say is, are you taking any supplements? First of all, I just want to have a little bit of a, let's say, a survey. Are you taking any supplements? If you have been diagnosed with prostate cancer, are you taking any supplements? If yes, can you please share with us what you're taking, the doses, how often you take them, why you're taking them? Are you taking them just for general health, or you're taking them for prostate cancer, or a specific symptom or side effect you want to reduce? And have you seen any difference? And how long have you been taking them? I'm interested to hear. And it doesn't have to be here. If you're watching this after the live, after I publish the live, please also, you can actually write in the chat. I tend not to recommend usually supplements. I always want to basically use food. Use food for everything because you have to eat every day. Why not actually eat things that are dense in nutrients, that are providing your body everything that you need? And if I know I need to increase a certain nutrient, a certain mineral, a certain vitamin, or just some form of chemical, why wouldn't I give it in the form of food, which is way more natural, way more usable from our body, rather than prescribe basically a supplement. So I always try to use food. We have to eat every day. Might as well have a meal plan that will actually give us what we need, right? Sometimes though, especially with modern farming practices, and especially when I want to reduce a side effect or a symptom, I might need a little bit more of a certain nutrient, so I will recommend a good quality supplement. So I would like to hear about any supplements that you found absolutely necessary and why. Stephen, hello. Stephen says, hi, my name is Steve from Wales in the UK. I was diagnosed with prostate cancer March 24. It is stage 4, as it is also in several places in my bones. I've had 20 radiotherapy sessions over 4 weeks. Steve, I wish you the best of luck. I hope you can remain strong most of the time, at least. And I hope you can still find ways to enjoy every day and find things to be happy and joyful. I would suspect your radiation therapy would be basically not just for the prostate, but also in those metastasis sites. Have you been having quite a lot of fatigue as well? Because especially radiation therapy in other places, apart from the prostate area, can be very fatigue inducing. Steven says, I take 4 60 milligram apalutamide a day and have a quarterly Prostate injection. My PSA is monitored quarterly and is undetectable. Is there a way to know the cancer isn't spreading? I find the flushes very debilitating. Is there anything that can help? Okay. Well, apalutamide is... So are you taking only apalutamide? So apalutamide is a medication that blocks the the action of testosterone on the actual receptors. So things like Lupron and Zoladex will prevent testosterone from being released, okay? However, things like apalutamide going to prevent any circulating remaining testosterone from actually having an action, okay? So I would suspect you would also be getting something else with apalutamide that would be blocking testosterone. So when you have that combination of radiation therapy with androgen deprivation therapy and androgen receptor inhibiting medications, that trifecta causes a lot of fatigue, and yes, it causes a lot of hot flashes as well. Stephen, what I can say is do send me an email. We can definitely work as well. But what I would tell you from now, to reduce the... First of all, when you get a hot flash, just go under the shower if possible. If you're at home, just have a bit of a shower to cool down. Things that could help is also having like a wet towel and putting it at the top of your back. Some supplements is certain forms of magnesium might reduce the hot flashes, and there is also a herb that I use sometimes with the men that I work with. Is called black cohosh. I have a list. If you go on my website, I have in the resources a list of Amazon products I use because I have researched them. You will find in that list black cohosh, so I would recommend that. In terms of diets, I usually give flaxseed, pumpkin seeds, raw pumpkin seeds, and carrots, actually raw carrots. That seems to remove excess estrogen and sort of balance the hormones as well. So that's what I can tell you from now, but if you need more guidance in implementing those changes that in a way that work for you, for your body, and also for your lifestyle, please send me an email. Yeah, so Stephen, you're taking this Prostate is basically Lupron, which Lupron is the most common androgen deprivation therapy there is in prostate cancer. It's very used medication. Very, it tends to create a lot of fatigue, a lot of hot flashes. Lupron. Usually people, like everyone who I've seen on Lupron, will struggle with a lot of fatigue. Now there is a new medication called Orgovix, that tends to be much milder. So if you get the chance, for any men watching this in the future that are thinking of going on ADT, or they have been recommended to take ADT, if you have the option to get Orgovyx rather than Lupron, definitely go with that. It matters a lot, actually. Well, okay, I've asked for supplements. Maybe someone would like to weigh in about exercises that they do. So, are you currently exercising? If yes, I'd like to hear a little bit more about it. What do you do? What do you enjoy it, which is the most important? And what forms of exercise do you do? How much? How often? Please share with us. And what do you feel when you exercise? And I will also want to know if you do any pelvic floor exercises. If yes, how often? What is the program? How do you do the contractions? How often? How many contractions? Anything about the pelvic floor exercise program? It's very hot here in Greece, even though it's 8:45 p.m. It's still very hot. Steven says, I cycle and use an indoor rower and do some light weights. I feel better when I exercise. But he doesn't know anything about pelvic floor exercises. Okay. Cycling is amazing. I would recommend, definitely, if you are trying. I know it's very hard for you, Stephen, especially when you are under such a powerful regime of medication, Lupron and apalutamide. The fatigue, the hot flashes doesn't make it easy to exercise. But please continue doing. Trust me, if we were able to get you to feel and compare yourself if you were not exercising regularly compared to now, you would see you would actually have more fatigue levels, more fatigue from the ADT, I mean, just hour to hour, just the resting fatigue would be higher. So cardiovascular exercise, and I have a video on my website, on my YouTube channel about that. Cardiovascular exercises are extremely important during ADT to not only reduce the effects of the ADT on the cardiovascular system, but also to reduce the fatigue that comes with that. So please keep doing cardiovascular exercise, cardio. If you want more guidance on how exactly what works, check the video on my channel. It's the video that talks about radiation and fatigue, what to do about that, radiotherapy and fatigue. It works the same with ADT. And actually most men on ADT have received radiation. So yeah, there is lingering effects of radiation therapy on. So when you finish with radiation therapy, you have, for example, your 20 sessions or your 30 sessions or 35 sessions, it doesn't mean that it's over. So radiation therapy actually starts working and keeps working for years after you finish. During that time, because it's burned flesh that it slowly starts burning, and the cells start getting destroyed because the energy from the radiation therapy has ticked like the bases of the DNA, and also there is a lot of oxidative stress. You need cardiovascular exercise, cardio exercise, for years after to manage the fatigue from those 20 sessions of radiation therapy. So you still need to be actively exercising, otherwise the fatigue it's gonna start creeping up. So Stephen, you're right. Like a lot of men, even in Western countries like UK, they still they still don't know how to do pelvic floor exercises. Now there's in better medical centers, they would have nurses that they would tell you should do pelvic floor exercises, but that's it. Like go figure out on your own. Or they would just tell you how to do them in a wrong way. There's actually it's very important to follow a proper protocol to do pelvic floor exercises, and you need to stimulate different muscle fibers, these different areas of the pelvic floor muscles. So I give that to my clients. I lead them, I guide them on how to do that properly. But they usually recommend pelvic floor exercises for surgery. So when you have prostate surgery, prostatectomy, unfortunately many clinicians don't know that the men should start doing pelvic floor exercises minimum 6 weeks before the surgery to strengthen the pelvic floor muscles, because when you go and remove the prostate, the weight of the bladder and all those the hollow that is created there is not supported. So you need to actually improve your function. You need to improve your control of your pelvic floor muscles and their strength and their tone and their size. So you need to start much earlier your pelvic floor exercises before the surgery. Usually they will have the surgery, boom, they suffer from incontinence, erectile dysfunction, then they're gonna tell them do pelvic floor exercises. If they're lucky, they're gonna give them a half-baked protocol. However, not many clinicians or even nurses recommend pelvic floor exercises after radiation therapy, which is super important to do. First of all, it is likely to suffer from incontinence and erectile dysfunction from radiation therapy. But also, you want to be actually working out your pelvic floor muscles for years after with the radiation therapy. Because as I said, the damage, the burning keeps happening for years after the radiation treatment. So you need to be bringing in blood to the area. You need to be stimulating the muscles to prevent the fibrosis, the creation of scar tissue. in those areas as much as possible. So doing correct pelvic floor exercises, following a correct pelvic floor exercise program every single day is super important. Not just after prostate surgery, not just before prostate surgery, but also before and after radiation therapy. Nick Frolos, hello. You sound Greek. I have a crazy hair day today. Hello guys, I'm gonna be signing off in 10 minutes. Here's your chance, first of all, to join the Facebook group for lifestyle medicine for prostate cancer. I have pinned it in the chat. Please join. I'd like to create a community of men sharing tips for prostate for lifestyle tips. Anything, how to use your lifestyle, diet, exercise, physiotherapy, mental exercises, breathing exercises, all the non-pharmacological stuff to actually not just respond to prostate cancer and reduce the growth. That's gonna be the side benefit, but more like live your best health, live your best life, use your diagnosis instead of like a death sentence, more like a life gift, a gift for you to live your life properly. I want to cultivate that in the group, in the Facebook group, pinned in the chat. I will also be sharing some exclusive content there, some exclusive tips. And I will also be hosting once a month a men's group, which is going to be a live call where you'll be able to share your story, ask your questions, just check in, let us know how you are, what's been going on lately with you. Share it with other men who can listen, understand, because they have been through a similar journey like you. So please join. Now's your chance for the next 8 minutes to ask any questions you want. If you if you didn't manage the live stream and you're watching this after the live stream, please write as a comment on the video your questions, because I'm looking for ideas from you, your questions, so I can make videos and respond to them and offer you value. Nick asks, how do you feel about PAE? I'm not sure what that is, Nick. What can you please spell it out, or just what is that acronym standing for? For the next, guys, for those joining in, gentlemen, please say hi, where you're from, anything you want to share about you, your journey, any questions, or just say hi. Still got a few minutes together. Very interested to hear where you're joining us from as well. Right now I am in Greece, specifically Thessaloniki, Greece. Enjoying the Greek summer. That's why you see my hair being all crazy today, because I was at the beach earlier on. Came back home, had a quick shower. For my live stream, well, can you blame me? It's summertime, it's Sunday, and there is some beautiful, the sea here in northern Greece, close to Halkidiki, if you know it. it's beautiful. So yeah. All right, gentlemen, 5 minutes till I go and have dinner. Please share your stories. Any last minute burning questions? If you can't make it, well, you can always send me an email. Ideally, actually, there is men sending me emails with questions and I'll answering them, but ideally I would want to shift that to the Facebook group that I have pinned in the chat that you can join. I would like anyone to ask any question in there, which that group is specific for lifestyle. So there is other groups that you can ask questions about treatments. Good. The group that I'm gonna create is anything non-pharmacological, okay, which also includes, okay, how to manage side effects like hot flashes, fatigue, all that stuff, erectile dysfunction, incontinence. That's gonna be part of it, but we're gonna be focusing on more like natural remedies without condemning, of course, medical treatments. You have to do medical treatments if you want. It's your choice, but I want to offer the wealth of knowledge on non-medical treatments because, you know, the world needs to also focus on the other area. It's not one or the other. Both can coincide and both can complement each other. So yeah, I would like the questions to be pointed to the group so other men can, I will answer in the group so other men can see my answer, but also other men can weigh in and offer their perspective as well. I'd love that, to build a community there. Nick Frolos talks about prostate artery embolization. I think that's more, I've seen that, I think that's more of a treatment for benign prostate hyperplasia. It's great that the more and more, yes, so that's right. This prostatic artery embolization is minimally invasive that helps improve urinary tract symptoms caused by benign prostatic hyperplasia. Yes, you have more wiggle room to play when it comes to BPH. When there's no cancer, you can experiment. Okay, so I would definitely go for some of these less invasive therapies. So I've had clients that did HOLEP, which is basically they go in and they shave the prostate, so they shrink it, causes a lot of inflammation, a lot of damage. I like those new techniques that come out that actually are way less invasive. Also, I forgot, I gotta share some good news. My own dad has BPH, so he's 62 years old and his prostate is 93 milliliters. Okay, the average for his age should be 60, but his was 93. His PSA was 5. Thankfully he doesn't have any issues, so he only gets up to pee at night maybe once, and that's it. No issues. It's just the PSA was very high, like 5 for BPH, and thankfully there's no malignancy there, but we're monitoring. However, I immediately got him on a program to focus that diet, mostly diet. Latest reading, PSA went to 4.5. Still managing that, but it was great to see a reduction of PSA. And that's the kind of stuff I also do with my clients. So if you're interested, you can send me an email. I don't directly guarantee that my programs will reduce PSA and fight cancer. What I aim for is build your health, your immune system, your digestion, your sleep, your stress management, your life, your fitness, everything. We implement stuff that I know and has been shown by evidence to reduce the growth of prostate cancer, not just the risk of getting prostate cancer, but actually if you have prostate cancer, these foods, these lifestyle ways actually reduce the growth of prostate cancer. Um, but yeah, reduction in PSA and tumor growth and everything should be a side benefit, not the primary focus, because otherwise you're just focusing all the time on cancer, which is not, you're losing, every day feels like you're a patient. So Ajay asks, does nano knife, I think you're talking about nano knife before. Yes, I had nano knife surgery in 2023, but cancer is back and has a Gleason score of 6. What treatment you would suggest? Look, I haven't had anyone who has had nano knife before. So actually nano knife, if you're talking about nano knife, which is interesting, I have, like in Australia, it's not prescribed by Medicare in Australia, so you have to pay from it, but basically it zaps electricity in the prostate. So if in the prostate the cancer is more like Gleason 6 or 3+4, and it's still within the prostate, it hasn't touched the capsule, which is dangerous to spread, they can do focal therapies. Focal therapies are more like regional, like targeted therapies. So there's things like high intensity frequency ultrasound, there is cryotherapy, there is laser ablation, and there is also nano knife. There is also cyber knife, which is very targeted stereotactic radiation therapy. Now, nano knife is more recent. It's an older technology, but now has been starting to be implemented. Still in Australia was not covered by Medicare last year. So you have to pay like $20,000 for it. But they basically insert electrodes and they cook a part of the prostate. You can still actually have erections, have urinary control, and still produce semen, actually. So just very targeted. I've had a client who did another focal therapy, cryotherapy, which a year after caused recurrence, so he got cancer back. These targeted therapies, these focal therapies, are way gentler to the system and they still preserve most of your prostate, but we don't know. We're gonna see. I feel like we're gonna see that they don't do the trick to cure the cancer. So I would only recommend them in those who have very low Gleason score and they can afford to experiment. If you have like a Gleason of 9, or definitely you gotta do something fast. And says cancer is back. Yeah, sorry to hear that, Ajay, that cancer is back. What treatment would you suggest? It depends on your age. Usually if you are over 70, they would go for radiation treatment. If you are in your 50s, they would recommend surgery. A Gleason score of 6 is something that you can actually watch and wait. What is your PSA? You can actually, I have a video that I talk about metrics like PSA velocity, but it's mostly the PSA doubling time, and I offer a free spreadsheet that you can use. Have a chat with your urologist, but a Gleason score of 6 you can actually watch and wait, as they call it, active surveillance, without treating. if only you see that your PSA is rising, has risen twice in a row, and the doubling time has gone below 12 months, that's when you can consider treatment. But many times a glycemic score of 6 is focused on the lifestyle. But of course, just follow what the urologist says. I'm just saying what I would do, okay? I can't offer medical advice here. Yuri says, I got a glycemic score of 3+4 in January 2017. Didn't do any treatment, just daily diet and daily workout. What do you think? Well, tell us how you are now. Have you tracking your PSA? Have you managed to keep that under control? What kind of diet and exercise? So just give us a little bit more. Alright, I'm just gonna wrap this up soon. Just any last comments? And again, I want to remind you, I want to invite you to join the Facebook group. It's pinned in the chat. Please do so. We're gonna be share some tips and tricks that you might not be aware of that may make a big difference in your journey. And of course, I talked about organizing that monthly men's video call. As well, I want to remind you that through my website, which you can find in the description, you can apply for coaching, which is basically one-to-one work with me. We work at a weekly basis. We have a video call once a week, and I guide you on what diet to have, what things to change in your lifestyle, exercises, anything, physiotherapy, occupational therapy, behavioral change. We have a call once a week that we do emotional support. We work through things in the mind, in the heart, in everything, in life as well. We improve your health, your fitness, your immune system, your strength, your digestion, and we use the diagnosis of prostate cancer as a gift to basically change our lives and change our health rather than something to be afraid of. Okay, so you can apply for that if you feel you want some one-to-one support that actually works around your lifestyle, of course. Mick, 0.3 PSA after 3 years. Beautiful to hear. Keep going, keep doing anything you can, and most of all, keep living life to its fullest. Lovely to hear that. Yuri says, I drink 3 to 4 cups of carrot and green juice daily based on Gerson therapy and play SOCAM 62, feel better than before. Beautiful. That's what I want to see. I want to see men that after a diagnosis, unfortunately many men, they lose the wind from their sails, but I want to bring examples like that when men actually use the diagnosis as a turning point in their, not just their health, but just their life. They completely, radically change how approach everything, including relationships and relationship to themselves. And they see that actually it can be done. Like when life gives you something that you never wished for, you have the strength to do something to turn it to work to your advantage. So I love to hear those stories. Mick says he grows his own food and exercises regularly. It's his best treatment. I love that, Mick. I love that. Well done. Keep going. Keep going and keep being an inspiration for others. And also please join the Facebook group where you can actually share your journey, your tips, what you're doing every day and you're managing to reduce your PSAs and live your best life with other men because they need it. I want to build a community that men who has gone through the journey and they have found ways can share them and empower other men, teach them that they can do things. It's not, they don't have to be passive, they don't have to be handed what they're being given and what they're just told to not do anything or live in fear. They can do things. Yuri, sorry to hear that. If you need support, please send me an email and we can I can offer help and support. Gentlemen, I want to wrap up. One last reminder to join the Facebook group. It is pinned in the chat. Okay, I want to build a community. Thank you for those who joined. For those watching this from home later than the live stream, you can still use the chat and contribute to the questions I asked. Okay, please do so. Do so. I always love to hear your stories, getting to know you, getting to meet you, saying hi, and seeing if I can help you in any way I can. Thank you for joining me today. Have a lovely rest of your day or evening where you're from, and I'll see you in the next videos. Bye bye.